Hi, welcome to Health Advocates Ask the Expert series, a monthly show about trending topics in healthcare. I'm your host, Courtney Preiser. In today's episode, we'll talk to Health Advocates Rich Prall about the value of preventive care and biometric screenings. Rich leads Health Advocates' Biometric Screenings Division and specializes in integrating preventive care into a total health and well-being program. Thanks so much for being here.
Thanks for having me.
To start with, can you tell us a little bit about what are biometric screenings? What are the tests involved and who really conducts them?
Sure. In a typical biometric screening, there's going to be some sort of blood test performed. So either that is done either by a finger stick or a blood draw to collect things like cholesterol, your lipids, glucose, and then even in some cases add in body composition. So you're taking your height, your weight, body mass index, and even blood pressure. And then people who perform these tests can be registered nurses or EMTs, and even if you had on-site wellness coaching, you can have wellness coaches on site as well.
So great overall picture of health.
Absolutely.
What typically happens after the test? How are these results used?
So a lot of times, if people are getting their results immediately, there could be on-site health coaching there where people can review their results, see where they fell as far as the ranges, what behavior changes they can make, and little improvements. After the screening, that data itself can be incorporated into an overall wellness program. So even things like a health risk assessment, or even can be used in a chronic care disease management program where you're stratifying risk and seeing where people fall and what outreach can you make to those people.
A lot of uses for a little bit
of
information. What is the benefit of screening both for the individual employees and for the organizations conducting this?
Sure. For the employee, it's really a way for them to see their numbers, to get a baseline and then see how it improves or not improves year over year. A lot of people haven't been going to an annual physical every year, and even we get feedback on site from employees saying they use this as an annual barometer to see where they fall. From the employers, one of the recent studies that we conducted where we wanted to see out of about 31,000 participants that we screened, how many of those people had hypertension. And from that, we found that 6,400 of those people had hypertension. But the interesting thing was that 4,400 of those people were undiagnosed.
Wow.
So from an employer perspective, you're taking people on site every day, or when we screen people, and how many people have we impacted as far as not her undiagnosed, and now we can show that they're undiagnosed, and maybe incorporate some of our programs to take some action. So from the employers, it's really getting that baseline, how I can incorporate programs from an overall perspective to impact my population and improve my medical costs.
Big benefit.
Absolutely.
How can biometric screenings be incorporated into the larger overall health and wellness program for an organization?
From a wellness program, it's usually the baseline or the first step in any sort of wellness design. It gives the employer a way to a starting point for their population and some data. And then from there, we can shape the program to either include an incentive program or health risk assessment. And looking at that data year over year, it also gives a barometer on how well the program's doing. And not only wellness programs, but other programs like a chronic care program, and see where their population is moving, whether it's improving or not improving, and then we can make adjustments off that data to continually to evolve the program to meet the client's needs. Customers that have screened with us for 5+ years and do it every year, because it gives them a good way to see that baseline, how it's improving or not improving.
It's a great measuring stick to customize their program. So how is Health Advocates' biometric screening program unique?
So since we started, we've been an in-house solution, so we really pride ourselves on not having to outsource our screening solution. We directly hire and train all of our staff, which gives us control of the quality of the event. So when we do events across all 50 states, we know that each event is going to our standards.
That's great.
And I would say it's just the flexibility. Health Advocate provides, being that in-house solution, we provide that customizable solution, because every employer is going to be different, and even every site inside of an employer's population can be different. And then really the other unique quality is the integration amongst our other services. Whether it's wellness or chronic care, that to me has been one of our biggest differentiators, is integrating those in-house solutions together to ultimately improve or meet the goals of what the client sets.
That's great to be able to adapt to what exactly they need right now.
Absolutely.
Well, thank you so much for being here. This is great.
Thanks for having me.
And thank you for tuning in. If you like what you just heard, you can follow us on our social media pages or subscribe to our channel below. And join us again next time for another edition of Ask the Experts.